Good morning. I am Dr. Biswajyoti Guha. I am a senior consultant associated with Motherhood Hospitals, Kolkata, which is a very new facility and a fantastic one. And I would like to talk to you about high risk pregnancy. Now we know that pregnancy is a physiological phenomenon, that is something that happens and occurs naturally, and it is absolutely acceptable for a lady to get pregnant and deliver normally, or having a cesarean section if she wishes to, or if there are certain indications for a cesarean section. But sometimes things do go wrong, and sometimes what happens is pregnancy is not as it should be. It becomes a bit more difficult than a normal pregnancy, and that kind of pregnancy is what we call high risk pregnancies. For example, pregnancy which is complicated with development of diabetes. Now we know that diabetes is a condition where there is a raised blood sugar, but in pregnancy, as we know that normal women who get pregnant are usually between the age of anywhere between 25 to 35, and normally they are not diabetic, but suddenly in pregnancy some of the women actually develop diabetes in pregnancy. This is something, not a very dangerous condition, but it is something which we need to be very careful about, because diabetes in pregnancy can lead to many other problems, and that can be detrimental for further continuation of this pregnancy. So the first thing that we do, we do a glucose tolerance test at around 26 weeks, and if there are any kind of indications that the patient is developing what we call gestational diabetes mellitus, in these cases we usually refer them to a diabetologist, and we try and coordinate the visits with the diabetologist so that the patient does not have to come twice to the clinic. And all our care are there for the diet, if medicines are required, medicines, if insulin is required in severe cases in insulin. These are all coordinated according to the protocol given by the diabetologist, as well as our protocol that we have here. So diabetes in a pregnancy is definitely a condition that we should be aware of, and women should be careful about, and if required, consultation with a diabetologist is essential in these circumstances. And of course, at the end of the day, if everything is fine, we have a fine mother and a fine baby, and that should be all right if everything is under control. So our motive is to control diabetes at the pick the diabetes up very quickly in pregnancy, so that we can optimize the blood sugar levels and optimize the delivery timings as well. The other thing that can happen in pregnancy, which is a bit more dangerous than diabetes, is raised blood pressure in pregnancy, something which we call pre-eclampsia.